section 1, 2, and 3. One deals with the Assembly plenary establishing committees, and one of those committees is the Select Committee on Health. 2 is the mandate given to such committees, that is, committees may be appointed to investigate or inquire into the activities or administration of ministries or departments of the government. And such investigation or inquiry may extend to making proposals for legislation or to investigate any matter of public importance. And then 3, for the purpose of effectively performing its function, each of the committees shall have all the powers, rights, and privileges as are vested in the High Court at the trial in respect of A, enforcing the attendance of witnesses and examining them on oath, affirmation, or otherwise; B, compelling the production of documents. So it is on the basis of this provision. We are not invoking the other, that is A, enforcing attendance because you have complied with attendance. But what we did not comply with is the submission of the request information on time. So we got an explanation. And then going further also, the standing orders of the National Assembly. That is what gives us, that guides us in terms of this session. That is Standing Order 94, Budget Implementation and Monitoring. 1, states, the Vice President or a Minister with responsibility for finance shall at least once during each session of the Assembly make an oral ministerial statement to the Assembly on the implementation and monitoring of the annual budget. And for your information, we have received information from the Ministry of Finance as per the budget implementation for the first quarter of all the ministries, all the MDAs, including the Ministry of Health. So that information is before us. And then got 2, Standing Order 94-2 states, nothing in this standing order shall prevent the Assembly committees from exercising their powers in relation to the detailed scrutiny of the monitoring and implementation of the annual budget or financial matters within their respective remits. So this exercise is a detailed scrutiny of expenditure. We are doing this to help you in the effective implementation of the budget that was allocated. And also, it can also inform our support for the ministry in future allocations. We want to see the rational utilization of resources. And we may have under allocation, you have over allocation. So the committee can support the ministries in this regard. And that's the reason for this session. So, as board controller, Mr. P.S., we would want you to explain why, and according to information from the secretary, the letters were submitted on the 22nd of April. We want an explanation before we proceed.
Okay. Good morning, Honorable Chair, the members of the Select Committee, honorable members of the Select Committee, subject matter specialists, the media, and my colleagues. Honorable Chair, as regards your question as to the timely submission of the documents, yes, I acknowledge that it was yesterday we wrote officially submitting the documents that we have prepared, and this morning we sent the email soft copy of those documents. I must say that it is nothing deliberate, and it is not a sign of deliberate refusal to do so. However, we want to create the indulgence of this honorable committee regarding the challenges we are facing at the ministry in terms of the emergencies posed on us by COVID and related to the COVID response at our level. I must say that when we received the letter, I think this, in my opinion, if I can recall, it was Wednesday that I saw the letter. And then I started consulting my technical teams at various levels to be able to collect this information. I was, however, very much preoccupied with other issues and the balancing of my real time among the various tasks became a little bit challenging, and also access to the information to be able to develop my slides and do the analysis became a little bit challenging. And if there are any lapses, it must be because of that. And I deeply apologize, and we would take note and make sure that it does not repeat itself. That is what I can explain as far as that issue is concerned. We are deeply sorry about that, and we will make sure we rectify that.
Thank you very much, Honorable Police Officer. The reasons advanced by the PS as to why they did not send the information they requested on time. And as we've agreed, and as has been clearly indicated, this committee has the powers of the High Court. It can compel the production of documents and on time. Failure of which we can invoke the contempt provision, and contempt according to the laws of the government is an offense. But we don't want to invoke that, so we have taken the apology, we accepted it, but advising that let it not to be repeated. That we are partners, we don't engage in witch hunting. We are partners in serving the people of the Gambia. So if we request for information on time, we are doing so to be able to do our effectively. And doing our effectively means supporting your work. So the members said that they would accept the apology, but that let it not be repeated. Next time when we write and request for information provided for us, because assembly members are very busy, they serve in various committees. And sometimes you can see even meeting concurrently, but they have to excuse themselves, especially when it comes to matters of health, like for your information. So we want you to also take that into consideration, that we don't want to go to that extent whereby we're invoking the contempt provision of failing to comply with our orders, for our demands. Thank you very much. So in fact, when we consulted, we agreed that we're going to allow you to present what you wish to present before us, but we are going to defer the consideration to Monday at 1 o'clock, where we would wish the Honorable Minister to be present, and the Minister of Finance also would be present for the consideration of the budget execution for the first quarter of 2021 by the Ministry of Health. So on that note, honorable colleagues, we would invite the PS to present the
Thank you very much, Honorable. And I want to thank the honorable members, Honorable, for accepting our apology, and we promise we are going to respect that view in our future engagements.
So you can advise us as to which document to Is it this one?
So the slide, yes, the slide, the presentation slide is the most summarized one.
Okay.
And there is also editing text narrating some of the points in the slide. Now, I'm presenting on behalf of the Ministry of Health, and supporting me in the House is a technical team, including Permanent Secretary Mr. Dampa, Deputy Permanent Secretary, Admin and Finance, and also our budget expert. And my presentation slide outline is going to give you an introduction, short one, then an excerpt of the 2021 budget table as per the business system. It's just an excerpt, and then monthly cash disbursed to the Ministry of Health by Ministry of Finance, the expenditure line, including the below the line account items, and we will explain what they are, and also the, if you like, the actual expenditure without the below the line account, and some implementation challenges. So introduction. Now the presentation is going to be based on 3 key tables, which we have provided copies, and those tables summarize the individual budget lines that we have and their subtotals. We also attach some percentages of those figures, how they relate to one another. So the first table will be the details of cash allocations received versus the Ministry of Health cash plan projection, and the expenditure scenario including BTL items, and the expenditure scenario excluding BTL items. Now the excerpt, this one, this first slide is just to show you how the items are captured in the EFIS system. It's just an example to show you the tables as they appear on the EFIS system. These tables are further explained below. Now, the monthly cash disbursed by Ministry of Finance to the Ministry of Health. Now, cash received over the period, we are looking at the period of January to March, but we have also added April, because those are the most of the figures we have in the system. So now we have total cash received from the Ministry of Finance of 251,101,755, as against the overall projection of 517,951,725.17. These figures capture only for the 4 months, and the 4-month cash projection as per our submitted cash plan to the Ministry of Finance. So you will see that based on these figures, you have a 48.57% disbursement by Ministry of Finance of those projected cash. This has also implications, because we have seen when we expected 100% cash disbursement to be able to implement our activities planned for that quarter, 100%. We got only 48.57%. So we expect implementation to be affected to some extent, and that's why we indicated how we have been down by 105.91% below target, below our target. So our cash plan is less disbursed by 105.91%, and that is
is what we summarize in this table. You can see in the table we have also tried to isolate the central administrative allocation. So among all the allocations received for a month, there is a component that is just for the operations of the administration. And that is the first column. We have the total for the 4 months received amounted to 9,832,132. Now, what you will see the second column where we have overall received GMB. That is the total cash received for each of the months, including the allocations to the submitted institutions. The submitted institutions are the hospitals and some of the councils. So that's why you can see if you do the percentage, you will realize that a large chunk of the cash received on a monthly basis goes to our submitted institutions. The other column is the 3 months or the 4 month cash projection as per our submitted cash plan. That is the third column, and you can see 517,051,725 was expected to be received, but we didn't end up receiving that. So the percentage is what I read to you. Now the next slide is the expenditure per line, including BTL items. Now BTL items are the below the line items that are captured on our overall budget, that are budgeted along with our core GLF, but they are also transacted through the IFMIS system. But in terms of expenditure, the funding sources are either partners or expenditures that don't have budget allocations in our core GLF. So you will realize that on our approved estimate, we have, including BTL items, 3.8 billion, but the expenditure for the 4 months and for the quarter amounted to 433 million, 264, 453.11, and if you net that off, you will see a budget balance of 2.6 million. Now that gives you a percentage expenditure to total budget, including BTL items, of 14.4%. But if you also net it against the expenditure, you will have amount unspent of 85.6%. But the next table will show you that when you eliminate the BTL items, you will have what exactly we expend as the ministry called GLF. And that is shown in this other slide. Now, as we were discussing here, we were revisiting the table. We realized one other item that we was cited and captured included in our expenditure, and it's a detailed item. That is the operating cost. Now, the operating cost, this particular operating cost that featured is a partner fund, and it is captured in the expenditures as operating cost. Now, if you remove that from this next table, the amount will go down. The amount will go down to 322,430,736 as expended, as money expended, net BTL item. That will give you, instead of 12% this implementation rate, it will give you about 19% implementation rate. So we will do that correction. Now,
members, it's also important to inform this August Assembly that all these expenditures are directed, reviewed and directed by a budget committee that exists at the Ministry of Health, and that is in line with the financial instruction. And since the beginning of the year, or even before, this committee has been in existence and has now been consistently sitting to review and also grant approvals for whichever payments that are going to be made. So the minutes of that are also available and that can be made available to this assembly. So every expenditure we conduct come as a decision of that committee. Now, among the implementation challenges, we noted that always, or most of the times, our budget expectations, as per our, submission to the Ministry of Finance, is not what actually gets approved at the end of the day, because we estimate our budgets based on the full requirements of the ministry. However, during budget bilaterals, expectations, are sometimes, cut. But we have seen also a trend, an increasing trend, gradually over the past 2-3 years. But then we still feel that what is being approved in the budget for the Ministry of Health year on year is not getting us near the 15% budgetary requirement to health. So we thought we need to bring that as a challenge to see how honorable members can also support that. Insufficient monthly cash allocations. That is the reality based on what we have just presented. We also face challenges in terms of the pace of implementation. We have also, some slow processes. For example, when it has to do with procurement, processes are slow sometimes, and because you have to observe all the legal requirements. And in a situation of emergency, which the Ministry of Health is prone to, sometimes it's a big challenge trying to observe the laws to the letter, but at the same time addressing the emergencies as required. So sometimes that's why we experience delays and slow pace of implementation as far as procurement is concerned. We also have limited personnel capacity challenges that also affects some of our implementation. Now, the negative impact of COVID is also really a challenge because COVID seems to taking most of the attention of everybody, including ministries. However, we also know that other aspects of life are also important, and all other activities need to get equal attention. But COVID, being a special of its kind, has been that challenge. Now, supply chain constraints. We have been observing supply chain constraints, both locally and internationally. We have a series of procurements that are on. Some have been concluded, but getting supplies really are a challenge. Some not for the fault of actually the ministry, but we also know that internationally there are serious supply chain challenges that the whole world is facing, and the Gambia is not spared. So that is also a challenge. We thought we need to make here.
say, okay, let me bring back my, just a moment. I wanted to also project, now, we also have a table among the list of tables submitted, a table that shows zero the votes that are with zero expenditure. There are votes that we have not spent any amount from, and
can you guide us?
some of them include.
Is there any hard copy to guide us?
Yes, there are hard copies.
Can you show?
Yes.
It's one page.
Yes.
How many pages?
No, it's
2 pages.
No,
Yes.
more than
2 pages of 5.
The one with
No, it's 2 pages. You have a solid.
It's okay, one.
This one.
About 5 to 6. Yeah, this one.
Okay, it's this one.
Yes.
Yes, this one.
Yeah.
Okay, you next time you also number it for reference purposes. Okay. You can also say you've seen it? I don't know.
Yes.
Okay, so we're there. You can guide us.
Okay, so these key among them are the National Health Insurance Subsidy vote. That vote still remains 100% unspent because we know that there are pending activities going on. However, on this matter, there has been a steering committee and a technical working committee working on the implementation modalities and arrangements, awaiting the outcome of the approval of the bill at the National Assembly. Currently, we know that we understand that the bill is before the August Assembly for consideration and approval, and some of the funds, are just waiting for that to be able to use. However, we are moving on with the other aspects of institutional arrangements to be able to put structures in place so that once the bill is passed, implementation can kickstart. That's why I said it's important that we bring that to your attention, as it will be seen in the figures, the tables that nothing has been spent on that board for now. Drug dressings and medical items. We have spent some amount of that, but this is also a vote that has to do with the procurement of medical consumables and equipment. The process of tendering for the use of this vote has been on, and at the moment we have done the tender evaluation, and the EPPA is considering the report for approval, so that immediately we will sign contracts for the procurement of medical items and consumables for 2021. So the spending there is not is limited. Just waiting for that process to complete. Now, construction of buildings and other structures. This is also another key budget line that not much expenditure has been carried out, or if at all, because as you will all notice, Ministry of Health recently has embarked on the assessment of health facilities all across the country, and we have put up adverts, and tender processes are going on, multiple tender processes are going on at the moment to be able to finalize contracts, and some of the facilities have their assessments completed. I'm just awaiting for clearance of the evaluation report so that they can be advertised. Some are already in the papers, and some have also been advertised already. The specialized and technical materials is also a procurement related item, because this is where we buy medical equipment and laboratory equipment. That is also a vote that is awaiting the conclusion of our tender process. Okay, so this is as part of the refurbishments and the and the construction of new health facilities. Currently, the assessment for Edward Francis, the refurbishment of Edward Francis Small Teaching Hospital, the polyclinic, and a new health facility to be constructed in Yao have been completed, and hopefully next week there will be a tender in the papers for actual works to be commissioned on those one. Members, in summary, this is what we have, but we will present all the detailed documents for your consideration. Thank you very much.
Thank you.
If any of my colleagues have anything to add, we want to tell you. It's okay?
Thank you very much. Thank you very much, P.S. Gaite, for presentation before the Select Committee on Health regarding the budget implementation of the ministry for the first quarter of 2021. But as agreed by the committee, we're going to defer discussion on the presentation to Monday. Monday, is it the 7th? No, not 7th.
10th.
Monday the 10th of May at 1 p.m. where we'll be having the board controller, the president of the PS, and the technical team, as well as the minister, and also the Ministry of Finance will present for a thorough scrutiny of the presentation.
And GPPA.
And GPPA as well. GPPA, yes. So that we'll have a detailed scrutiny of the presentation and the implementation process. As has been cited, based on the provisions of the Constitution and the standing orders of the National Assembly. The last item we were supposed to consider was AOB, but the AOB, that's the reason why we want the minister to be present. Because he's the one who's going to lead discussions around the AOB. There are lots of issues that this committee is going to raise with the ministry, and the minister is expected to lead the discussion, the engagement around that on the part of the government. Honorable colleagues, on that note, I think we're adjourning this meeting to Monday, the 10th of May at 1 p.m.
I move that we adjourn until Monday.
It has been moved by Honorable Maro that this session be adjourned Monday and supported by Honorable Dabo. So, thank you very much. PS1 and PS2 and DPS and budget experts at the ministry, and also the members of the media. So you are equally invited to that engagement. You have started it with us, so we want you to continue with it so that the public will be duly informed. Tomorrow we are going to have a similar engagement with the Ministry of Women, Children and Social Welfare, and you are equally invited. It's good that we inform the public about the work being done on their behalf, particularly in terms of budget execution. And this is all about the budget that has been allocated, how it is being spent. So, and the public, I think, deserves to know. And it is the media that can help the public to know real time. So, thank you very much, honorable colleagues, honorable members of the committee, subject matter specialists, committee clerks, and then the members of the media. So thank you.